Peter Hitchens is standing by. We are both about to watch this conference that is organised now, press conference. Chief Medical Officer, Professor Chris Whitty, Chief Scientific Advisor, Sir Patrick Vallance. Let's get to it.
At the moment, some of the knowns and some of the uncertainties. Let me just start by reminding you that this disease spreads by droplets, by surface contact, and by aerosols, hence the hands, face, space, but also to remind you that the way that we reduce the spread is by limiting our number of contacts, by reducing contacts in environments where spread is more likely. Those are crowded environments, indoor environments, poor ventilation, and making sure that we reduce the probability of coming into contact with anyone who is infectious, and that's the importance of self-isolation, keeping out of circulation if you have or may have the virus. May I have the first slide, please? I want to start by talking about the rise in cases elsewhere and what we can learn. We've seen increase in cases across Europe, and here I've taken examples of Spain and France. We've seen an increase in the numbers of cases. It started with younger people in their 20s and spread gradually to older ages as well. That increase in case number has translated into an increase in hospitalizations. As the hospitalizations have increased, as you look at the slide on the right here, you will see that very sadly, but not unexpectedly, deaths are also increasing. So there's a simple message from this slide, which is that as the disease spreads, as it spreads across age groups, we expect to see increase in hospitalizations, and unfortunately, those increase in hospitalizations will lead to an increase in deaths. The virus has genetically moved a bit, but it has not changed in terms of its propensity and its ability to cause disease and to cause death, even though, of course, most of the disease deaths occur in the older population. So where are we here? Next slide, please. These are data from testing, and I'll come back to that point in a minute, and they're data for England, but the picture is fairly similar across the UK, and Chris Whitty will say more about that. What we see from July, as we look at the increase in cases per 100,000 of population, an increase which has occurred over August and has increased into September. This is by different age groups, and the top line, the blue line, is amongst the 20 to 29-year-olds. But what you can see is there's been an increase in cases across all age groups. The lowest increase has been in children and in the population aged 70 to 79, but in every age group we've seen an increase. Could that increase be due to increased testing? The answer is no. We see an increase in positivity of the test done, so we see the proportion of people testing positive has increased even if testing stays flat. And if we look at other sources of data, such as, for example, the ONS study, which takes a sample of people across the population and looks at it, or studies like the REACT study, we see a similar increase. In the ONS study, it's now estimated that roughly 70,000 people in the UK have COVID infection, and that about 6,000 people per day are getting the infection. So we are in a situation where numbers are clearly increasing. They're increasing across all age groups. It's a little bit different in different areas in terms of geographies, and Chris will speak to that. And this increase in numbers is also translating into an increase in hospitalization, which Chris will say more about. So there's no doubt we're in a situation where the numbers are increasing. What I'd like to do is just remind you how quickly this can move. So the next slide is not a prediction, but it is a way of thinking about how quickly this can change. So this is the UK reported cases per day against time. And you can see running along the bottom there the number of cases over June, July, and August, up to roughly 3,000 cases per day or so in September, middle of September. At the moment, we think that the epidemic is doubling roughly every 7 days. It could be a little bit longer, maybe a little bit shorter, but let's say roughly every 7 days. If, and that's quite a big if, but if that continues unabated, and this grows doubling every 7 days, then what you see, of course, let's say there were 5,000 today, it would be 10,000 next week, 20,000 the week after, 40,000 the week after. And you can see that by mid-October, if that continued, you would end up with something like 50,000 cases in the middle of October per day. 50,000 cases per day would be expected to lead a month later, so the middle of November, say, to 200 plus deaths per day. So this graph, which is not a prediction, is simply showing you how quickly this can move if the doubling time stays at 7 days. And of course, the challenge, therefore, is to make sure that the doubling time does not stay at 7 days. There are already things in place which are expected to slow that. And to make sure that we do not enter into this exponential growth and end up with the problems that you would predict as a result of that.
You're listening to Sir Patrick Vallance, currently giving a scientific briefing. He's just put a graph up in which he says this is not a prediction, but actually it is a prediction.
One final word on this section. So as we see it, cases are increasing, hospitalizations are following, deaths unfortunately will follow that, and there is the potential for this to move very fast. A word on immunity. Next slide, please.
Hitchens coming up shortly.
When
after
people
this.
have an infection, the vast majority of people get an antibody response. And we know that some of those antibodies are so-called neutralizing antibodies. They do indeed protect against the virus. We also know that they fade over time, and there are cases of people becoming reinfected. So this is not an absolute protection, and it will potentially decrease over time. What we see is that something under 8% of the population have been infected as we measure the antibodies. So about 8%, so 3 million or so people, may have been infected and have antibodies. It means that the vast majority of us are not protected in any way and are susceptible to this disease. There may be other forms of protection that increase that number a little bit, other parts of the immune system, but it does mean that the vast majority of the population remains susceptible, and therefore you'd expect spread throughout them. The number of people with antibodies is a little higher in the cities, and it may be as high as 17% or so in London. That may confer a little slowing of spread, but not much more than that. At that point, I'll pass over to Chris to take you through some of the other features of the epidemic. Chris.
Thanks, Patrick. Next slide, please. What we have here are two maps. They're from England, but there would be similar ones from Scotland, Wales, or Northern Ireland. And what we have on the left here is a map where the darker colours are the rate of transmission. And on the right, what we have is a map where orange or yellow or brown represent an increasing rate of transmission. The darker that colour, the greater the rate of increase. And green or blue represent a stable or falling situation. And what you can see on the left side is that at the moment, the very high rates of transmission in the UK are highly concentrated in particular areas, but there are significant rates of transmission in many parts of the UK with the darker colours. But what we've seen is a progression where, after the remarkable efforts which got the rates right down across the country, firstly, we saw very small outbreaks, might be associated with the workplace or another environment. Then we've seen more localised outbreaks, which have got larger over time, particularly in the cities. And now what we're seeing is a rate of increase across the great majority of the country. It's going at different rates, but it is now increasing. And what we found is that as we go through in time, anywhere which was falling is now moving over to beginning to rise, and then the rate of rise continues in an upward direction. So this is not someone else's problem, this is all of our problem. Next slide, please.
This is Talk Radio. You're listening to Sir Patrick Vallance and his cohort, Chris Whitty, making predictions about what could happen in December and then telling us it's not a prediction. Hard to believe, really. Peter Hitchens will be following this immediately. I want to get his view. I'm pretty sure he'll be pretty outraged by it.
Early April. And it then stabilised for a period and flattened out. But over the period since the 1st of September, you can see a steady, sustained rise in numbers with a doubling time, as with the cases, of probably 7 or 8 days. Now, what that tells us is that if this carried on unabated, these numbers are relatively small. We're talking about around 200 at the moment. But if we continued along the path that Patrick laid out, the number of deaths directly from COVID, I'll come back to indirect deaths, will continue to rise, potentially on an exponential curve. That means doubling and doubling and doubling again. And you can quickly move from really quite small numbers to really very large numbers because of that exponential process. So we have, in a bad sense, literally turned a corner, although only relatively recently. And I think everybody will realise that at this point the seasons are against us. We're now going into the seasons, late autumn and winter, which benefit respiratory viruses, and it is very likely they will benefit COVID as they do, for example, flu. So we should see this as a 6-month problem that we have to deal with collectively. It's not indefinite, and as I come on to, science will in due course ride to our rescue. But in this period of the next 6 months, I think we have to realise that we have to take this collectively very seriously. A lot of people have said maybe this is a milder virus than it was in April. I'm afraid, although that would be great if that were true, we see no evidence that is the case. At the moment, because the cases started to rise most in the lowest age bands, in young adults, not in children. Children, the rates have really not increased, as the data Patrick showed young children, but in young adults, these are the group who are least likely to end up in hospital. And a point we made right from the beginning is that for many people, this remains a mild infection. But as you move up the ages, if you move into people who are more vulnerable, then the mortality rates, if people get this, rise to quite significant rates. And what we've seen in other countries and are now clearly seeing here is that they're not staying just in the younger age groups, they're moving up the age bands, and the mortality rates will be similar to, slightly lower than they were previously, but they will be similar to what we saw previously. And these are significantly greater, for example, than ordinary seasonal flu. So seasonal flu normally in the UK would on average a year kill around 7,000 people a year, tragically, and in a bad flu year, as there was, for example, about 3 years ago, it might kill upward of 20,000 a year. This virus is more virulent than flu. So the numbers people talk about are not unreasonable numbers for us to be thinking about. Treatment is better. There's no doubt about that. Doctors, nurses have learned to treat this much more effectively, and we have new drugs such as dexamethasone. These will reduce the mortality rate, but they will definitely not eliminate or take it right down to trivial levels. 2 other broad points I wanted to make. The first one is that there are, as we've said from the beginning, and it really does need to be repeated, 4 ways in which this virus is going to have a very potential significant effect on the population's health if we let it go out of control. The first, the easiest to identify, is direct COVID deaths, people who get the virus and die of the virus. The second would be if the NHS emergency services were overwhelmed by a huge spike, and that is what the extraordinary efforts of the population allowed to prevent happening in the first wave we met. The third, however, is very important, and I think its importance should not be understated. which is if the NHS is having to spend a large proportion of its effort in trying to treat COVID cases, because the numbers have gone up to very high levels, and trying to put in place large numbers of systems to try and reduce the risk of transmission in hospitals, it will lead to a reduction in treatment for other areas, in early diagnosis of disease, and in prevention programs.
I'm sorry, Chris Whitty. I just can't listen to much more of this. I'm going to have to interrupt it. Peter Hitchens is here with me. Peter, I can barely believe my ears with this stuff. We've already had an NHS which doesn't treat anything else because of the COVID scare, which never happened. Now they're telling us we're going to have another one.
Well, let's not say it never happened. It was obviously something did go seriously wrong, and a lot of it went wrong, as we now know, in the care homes, which is something which we could quite possibly do something quite useful about preventing again. What is startling about this is the presentation of figures entirely without skepticism or rational analysis. You talk of for instance, the figures for cases. It is not made clear that most of these cases are asymptomatic, and most of the people who are supposedly detected as having had COVID are perfectly well. An absurd assertion is made that the number of cases has not risen because the amount of testing has risen, which is quite obvious to anyone of the simplest intelligence cannot be true. If you test hundreds of thousands of people a week, you will find more cases. Also, it doesn't seem to dwell at all upon the major problem, which everybody involved in this is well aware of false positives, showing people who are positive who actually aren't. And then the other thing which nobody is mentioning is that on September the 30th, a mere 9 days away, Parliament has to vote on the renewal of the extremely potent measures of the coronavirus bill. And it seems to me that this whole ramping up of figures into the appearance of a huge second wave when nothing of the kind is taking place has much more to do with the political needs of the government and its desire to scare members of Parliament into accepting yet again legislation they ought never to have allowed to go through, is really what's going on. There are so many things one could say about these figures. I wrote on Sunday about this talk of the number of...
The 7 days thing, right?
Doubling every 7 to 8 days. It's technically true, but in a way which, if once examined, it clearly does not mean what it appears to mean.
No, indeed. And quite frankly, the most brazen statement, I think, that came out of Chris Whitty's mouth was that he said if UK cases double every 7 days, there would be 49,000 cases on October the 13th. He then talked about 200 deaths per day in November. And then he said, this is not a prediction, when it clearly is a prediction.
Well, they've all remember what happened, of course, to Professor Neil Ferguson's extraordinary modelling, as it was called, which a lot of people took seriously back in March, suggesting that huge numbers of people would die if we didn't take extraordinarily rigorous precautions. This has been, I think, pretty certainly proven to be false by the example of Sweden, where similar projections were made, and Sweden did not do things which the Imperial College would have wished it to do, and the numbers of deaths didn't follow. And I think any serious analysis of what happened has to say over and over and over again, the real tragedy was in the care homes. This was not caused by a failure of people to avoid each other's company or stay at home or do anything like that. It was caused by a mistaken moving of people from hospitals into care homes without testing and proper precautions. And this will doubtless be the subject of an inquiry. What it was not, and what the incidence of the disease was not, and never really has been, is particularly connected with the measures which the government is taking. No one has ever been able to establish any connection between these frantic measures and any result. And also we have to remember again this simple point. All these things can do is delay the spread of the virus. No human ingenuity has ever developed a way of stopping a virus from spreading. And there is a very strong, the point was made by one expert this morning, that the phrase herd immunity sounds callous, but it is in fact not callous at all. What it means is that if we can get enough people to be naturally immune to this disease, then its spread is halted. It's not an ignoble, brutal way of treating the population, saying, all right, we'll let you sink or swim. It is actually an effective, scientifically backed way of preventing the spread of disease. And in fact, it's the principle behind which vaccination works. the achievement of herd immunity.
Right.
Everybody's in favour of. And I've been astonished over the past few months. It's the first time I've said this because it seems to me the moment has now come. I've been astonished at the way in which people who were cheerfully arguing for herd immunity and vaccination now argue against it in this matter. And again, we have to say, are these people who are recorded as cases or infections actually suffering? For the most part, no. No, the disease is not weakened. But what has happened is that it has begun to spread among people who are far less at risk from it.
Yeah. And I don't know whether you could understand...
Large number.
Yeah, I don't know whether you could understand the graphs that were put up at the beginning of the of this session, in which it looked like per 100,000 people, 0.2 deaths was now the figure. If that is the figure, that's incredibly low, isn't it?
It's extraordinary how, in my own city here in Oxford, we were told a few weeks ago that if we passed the number of 40 people per 100,000 infected, so-called, with coronavirus, then measures would have to be taken, basically to punish us for misbehaving, going out, seeing people, and all stuff like that, which was allegedly causing the spread. But try as they might, by setting up an extra testing centre, which of course was never going to produce any more results, was it? Try as they might, they couldn't get it up above that figure of 40 per 100,000. 40 per 100,000 doesn't indeed seem to me to be particularly big. It's 4 per 10,000.
Yeah, it's hardly anything.
Yes, 1 per 1,000. And you think, who is drawing these lines and saying this is what matters? But I do advise people to look at my Mail on Sunday column now on my blog for an analysis of what the Secretary of State, Matt Hancock, has been going around saying about the numbers of hospitalizations doubling every 7 to 8 days. It's a very interesting use of the word "every" to refer to 2 periods of 7 to 8 days in the whole 30-odd week period of the statistics being studied. But there you are. And then there's a question: is it doubling, or has this number simply increased to that extent? Doubling is a different thing. If you say something is doubling every week,
yes,
you're claiming that something huge is happening. Events are not driven by mathematics. Mathematics are driven by events. Maybe the numbers of hospital admissions will rise hugely next week, and they will be twice as many as they were last week. But there's no magic which says that they must be because that happened last week.
Right.
It could be that they'll go up by the same number as they did the week before, in which case they won't double.
Well, exactly. And amongst many of the pieces I read over the weekends, including yours, which I thought was great, Matthew Syed's piece was very interesting as well, where he talked slightly more generally about this obsession that the scientists seem to have with dealing with what they call certainties, when in fact what they should be dealing with is the uncertainty. Because he says it appears as though the data is now being dragged towards where they want to go, rather than leading people to where they should be going.
Well, I think that's definitely the case. In this, you could see for weeks and weeks and weeks the constant repetition. There is a second wave coming. There is a second wave coming. You say it often now.
Right, and here it is.
Well, the principles of advertising. That's how people were persuaded to eat mashed potato.
Right.
You'll do all kinds of things if you repeat things often. But it doesn't necessarily make it true. The second wave there's no evidence of the second wave of the coronavirus. These second waves happen in influenza. And I keep saying, Professor Pennington will repeatedly tell you that there is no reason to believe there is such a thing. But once you've decided that it's going to happen, then you cram all the figures into shape to make it look as if it's happening. So even if it's a molehill, you will go around believing it's a mountain. And the government is currently turning a molehill into a mountain for, in my view, strongly political reasons, as very major developments are taking place. And Sir Graham Brady, the chair of the 1922 committee and intelligent representative of Tory backbench opinion, went on the radio this morning, and despite the vigorous attempts of Martha Carney on the Radio 4 Today programme to stop him from saying what he was doing by interrupting him every time he took a breath, and sometimes otherwise, he actually managed to get out the fact that he believed the government was ruling by decree, had no need to be rushing this legislation through, and to express a discontent which I think is spreading. And then you have another amazing development, where Baroness Hale, the former president of the Supreme Court, much revered by all liberals, as Lord Sumption was until he got involved in this, coming out and saying Parliament has pretty much abdicated its responsibilities. Yeah. Amazing thing. I think the mood is changing. If you look at the leader columns, the editorial columns of some of the major conservative newspapers this morning, you'll also find strong hints of exasperation, not just with the performance of the government and its policy, but with the policy itself.
Yes, I think that's absolutely right. I think it's very hard to find. I think you have to look in the very staunchest of staunch Tory heartlands to find a couple of voters who are still supportive of this government, because apart from them, everybody else has deserted them. I didn't start off by being, dismissive of Boris Johnson and the government. I thought in March, as you know, that they did the right thing. It's about the only thing now that you and I still disagree about.
I want to disagree with you about something else, Mike, because it's important. You've been very dismissive of Simon Dolan's court case.
I have.
I think you should not carry on with that. Whatever you may think of Simon Dolan, I don't know him. I have no connection with him, but he is actually doing something which badly needs to be done.
Well, let me tell you why I disagree with what he's doing. Well, let me tell you why I disagree with what he's doing, Peter, and then you can tell me why you think I'm wrong.
Sure.
I disagree with him because I believe that suing governments is the business of people like Jolyon Malm and those kind of idiots who wish to kind of change political decision-making by virtue of the law because they can hire very expensive barristers. And I don't think it's the way to go. I would rather put my trust in somebody like Graham Brady, who will hold the government to account since the Labour Party is incapable of doing so. And I don't wish to have taxpayers' money wasted by the government on defending what I regard as frivolous court actions.
Well, I wish it was so that it was nothing but frivolous court action. But the fact is that the introduction of judicial review in this country has meant that a significant way of getting governments to review their policies when they otherwise would not do has come through the courts. You can't pretend that it hasn't happened or that it's not available. And if other people are going to take advantage of it, as they most certainly have, then it seems to me that the right side should also take advantage of this weapon created largely by, it seems to me, the judicial liberal elite. They should take advantage of this weapon to point out that the government is not doing what it should be doing, is acting beyond its powers, which it is. You might say rely on Sir Graham Brady. I would tell you that if Simon Dolan were not doing what he was doing, if I wasn't doing what I was doing and you weren't doing what you were doing, and Lord Sumption wasn't doing what he was doing, and a lot of other people like Toby Young weren't doing what they were doing, then Graham Brady would have no standing. The reason why Graham Brady is increasingly being listened to in Downing Street, and I think he probably is, especially by those ministers scared of economic collapse, is that people outside Parliament have taken legitimate lawful action, which we're able to do. I mean, none of us is in favour of breaking the law, to try and make the case. And actually, judicial review is a weapon available to us. It would be very, very silly not to use it if we have it.
Well, I still disagree with the way that he is doing it, and I'm not particularly against him. The only reason it came up recently was because he tweeted me rather pompously that I was asking me whether I was ready to apologise to him yet. And I think
I'm not trying to get you two guys to like each other. That's not my business.
No,
but I think that in a matter like this, where the future of the country is involved, allies, even if they don't particularly get on with each other. I mean, Toby Young's not my cup of tea in many ways, and I've told him so. But on the other hand, he's been tremendous.
You're not the first person to have told him that, by the way.
I'm skeptics, and I am full of admiration for what he's done, despite the fact that on so many matters I disagree with him. So, and he is, as they say, extremely hard to like. So that's not the point. And that's why I think that if you've got bile to spare, then send it to a different direction.
Yes. No, listen, there's no bile involved. I don't particularly dislike him. I think he appears to be a little bit pompous, and that doesn't bother me whatsoever. But he does live abroad. He does make use of his money to sue the government, which so far has been entirely unsuccessful and looks as though it's not going anywhere anyway. And I just think we have better fish to fry and we have better ways of doing it. That's all.
Well, I'm in no position to attack anybody for pomposity, and on top of that, I think that the success or otherwise of Simon Dolan's case it would be a bad thing if it failed. I think myself, the courts have treated it with far too little respect, though it has. The last stage at which it did reach a judge who appeared to see that it was an important matter. As I say, I just think it really is something where we all need to put our shoulders to the wheel. All of us, not the lunatics, not the Bill Gates maniacs and the David Icke and all. No,
listen, Peter, I take your point. I take your point absolutely. But what I don't respond very well to is people asking me to apologise to them for something which I don't think I've actually done. So listen, stay with us though, because we're going to take some news here. We're going to find out precisely what else we've got to do to try and halt this ridiculous lockdown. There was one brief appearance of sense from Chris Whitty right near the end, where he said that if they don't go far enough, there will be a problem with new cases and new deaths, but if they go too far, it will be damaging to the economy. So at least he's recognising that he might be damaging the economy. We'll be back with more with Peter Hitchens very shortly. We were talking to Peter Hitchens, Man on Sunday columnist, about a great many things, not least the reaction to a press conference which has just been held by the leaders of the scientific community advising the government about COVID-19. Chris Whitty, of course, the Chief Medical Officer, Chief Scientific Advisor, Sir Patrick Vallance. Peter, let's go back to some of the things they said. They said they've turned a corner, but not in a good way. They've said that basically, despite the fact that they're predicting 49,000 cases on October the 13th, it's actually not a prediction. They have made one at least small accommodation to saying that if they go too far, it might be bad for the economy. So that maybe there's a chink of light there somewhere.
Well, maybe there is, but I think what anybody looking at this and fearing, as we all do, a repeat of the dreary events of March, has to say, isn't it time the government searched a slightly wider pool of experts and advisors? Isn't it time, for instance, that Professor Carl Hennigan, the Centre for Evidence-Based Medicine, was brought in to take part in these press conferences, to take part in the advice, and also the whole SAGE committee was looked at again and given at least a reasonable representation of people who are sceptical about the government's position. Well, governments take advice, alas, they take the advice they want to take. The most crucial example of this was the Iraq War, when they took the advice only of people they wanted to hear, and those who really knew about Iraq were excluded. It really is time we had some more people involved who were able to give, particularly as Professor Hennigan can give, or indeed as Professor Sunetra Gupta, the expert on the spread of disease at Oxford, in fact, a very similar standing to Professor Ferguson, but having very different views. These people should be called in, listened to, and allowed to take part in these events. We shouldn't just have one view, which we have at the moment. And that would seem to me, I'm tired of being told, oh, you're not an expert. Why should we listen to you? There's Chris Whitty, there's Patrick Vallance up there. They're experts. And there are you, just some journalists saying, well, this, that, and the other. Well, of course, I'm not an expert, but the point that I make is that the advice which these experts give is taken by people who are even less qualified than I am. I don't see.
But also the thing that you and I are expert in, Peter, is looking at expert behaviour and expert prediction and expert rules and regulations and working out how successful they've been. And up to now, they've been pretty unsuccessful with their predictions and with their instructions.
Well, it's I would say extremely unsuccessful, and because as I say, we don't in this country have a particularly good record, even on the terms which the government has set of controlling the disease, which spread rapidly into care homes and ended up killing a tragically large number of old people. Nor is there any evidence, it seems to me, that the measures that have been taken are working. We're constantly pointing to graphs that are produced for Spain and hospital admissions in Spain and deaths in Spain, which are indeed going up. Actually, of course, at this time of year, deaths of this kind do go up. It's not unusual, and it wouldn't be particularly surprising if they did. But the truth is that Spain has been applying measures of astringency which make ours look quite mild. So if these measures, the mask wearing, the social distancing, the 1.5 meter rule or whatever it is now, the rule of 6, if these measures work, then why is it that the countries such as Spain, which apply them so severely, aren't now free of the disease? The reason is simple, because they don't work, and they were never going to work, and they're frankly a fantasy of government. A Canute-like belief that government can control things it can't control, and here we are.
Yes.
We are.
Well, I'm slightly encouraged by at least the fact that they've used the words in this briefing today. We're going to have to live with this virus for a long time. So that means they're going to have to adapt and live with it rather than trying to fight it. But I don't know whether you've seen this morning that Professor Carol Sikora has put out a tweet today in which he includes a letter which has been sent to the government, including to Boris Johnson, Rishi Sunak, Chris Whitty, and Sir Patrick Vallance as well. And its authors are Professor Sunetra Gupta, Professor Carl Hennigan, and Professor Carol Sikora. And included in that are a whole load of other signatories, including Sir Hugh Pennington, former Chief Medical Officer, urging the government to change course, to change tack. And so this, I think, is going to be a significant letter which the government surely will have to pay some attention to.
Well, that is fantastic news, because it gets rid of this nonsense that all the experts are on one side and that nobody who knows anything about it takes one view. And I think several of those names have been extremely courageous in the past few months, standing up against a howling wind of almost imposed consensus, which is, even in the scientific community, which is supposed to accept and encourage reason, has been very worrying. I think quite a lot of scientists felt something approaching fear, and you will have noticed that Sunetra Gupta a couple of weeks ago confessed in the Evening Standard that she was having trouble. She, a very distinguished scientist, an Oxford professor, having trouble getting her work published in scientific publications. This gives you an idea of the intolerance in the scientific community once an idea takes hold. So this is encouraging. There are many, many encouraging signs in politics, in journalism, among actual scientists, and I very much hope now in the law courts as well, after what Baroness Hale has said. People are beginning, I think, to come to their senses and realizing we can't go through another 6 months later.
No.
It's not rational. It's and also the bills are just going to have to be paid. Every time any of this is discussed, I have to say again and again, remember, the 30th of September, that's the day the government needs another compliant, dead parrot parliament meeting to allow it to maintain its coronavirus act in being, which should never have been passed in the first place. And I remind people, was passed without a vote.
Right.
On its first appearance before Parliament. One of the most severe restrictions on liberty ever passed by the Parliament of this country without a vote, or frankly a serious debate.
And which has now resulted in the rather ludicrous episode of the possibility of being fined £10,000 if you are out of your house when you're not supposed to be, even though there might be nothing wrong with you.
Well, this is when we're reaching a wholly arbitrary situation where law is no longer law. It's just the will of the government imposed by the police on more or less randomly selected individuals. This is lawlessness. And when people say, well, would you break the law? And I say, no, absolutely not. Nor will I encourage breaking the law. The real threat to the rule of law and to actually social peace in this country is when the government abandons the rule of law and rules by decree and turns the police from a body of men enforcing the law with public consent into a state militia. When these things happen, the undermining of law, which depends so much on everybody believing in it, is terrifying. And I am absolutely not the person undermining the law. But these government actions, they do that. A strong state of the kind that's being hammered together here by these people is very dangerous to the rule of law and social peace. They should think very carefully what they're doing, and look now at the horrors of what's going on in Victoria in Australia, where the state government has taken on powers unprecedented in any free policy that I know of. And it's really very shocking indeed that these things are even contemplated.
Yes, quite. And I find it quite ironic, because I've just had a tweet from somebody reminding me of this, that the Labour Party, currently led by a former human rights lawyer, doesn't seem to care much about the human rights of British people.
You know, he's also a former Trotskyist, of course, which I wonder which of the two struggles in his mind more vigorously. People don't realise this about Keir Starmer. He was in the sect Serb Skjor. They have a special name, the Pavlovites. But it's the problem is, apart from anything else, that every member of Parliament, from Keir Starmer and Alexander Pfeffel, Boris Johnson downwards, they don't realise, or they seem to have forgotten who they work for. And I am urging everybody now to write briefly, politely, but acidly to their members of Parliament. Don't try to change their minds. Most of them can't reason. Just make it plain to them that their seats are at risk if they carry on like this. Say to them, I have observed over the past 6 months, you have not been doing the job for which you are lavishly paid. You have not been legislating. You have not been holding the government to account. You have been doing nothing. What is it that you do?
Yes.
If you can't explain this to me, then please understand that when the next election comes around, I may be seeking somebody else to do the job, which you're being paid for without doing. People should write in large numbers to their MPs making this point. The one thing that gets an MP's attention is fear of losing his or her seat, and we should make them do that. Yes,
absolutely right. And I mean, a lot of people also making the noise now about maybe trying to find a third voice, and I know that's difficult in a two-party system, but the Social Democratic Party, William Clouston, the leader of which I have on my show on a fairly regular basis, they seem to talk a lot of sense. They're the first political party that has actually come out against these lockdown measures. I mean, if only you could turn that into some form of sort of people's movement.
Here's the problem, Mike. It's 17 years now since I began my project of destroying the Conservative Party to make way for some new party of this kind. Do you know what? Nobody wants to do it. It's been a thankless, lonely task, partly because so many people who regard themselves as Conservative patriots will cling to the Conservative Party even as it becomes a sort of Euro-communist mad party, because they will say to you, but we can't let Labour in. So they won't give it the final fatal kicking. So it survives. So there's no room. William Clouston, no doubt, an intelligent fellow. There's no room for intelligent thought in politics as long as these corpse parties survive on the basis of state aid and dodgy billionaires, as they do. And there we are. And it's nice to think of it, but until people really do turn against this lot in a pretty big way, then we're stuck with it.
Well, I mean, we're certainly going down that road. I don't know I don't know of a time when people were more angry with the party that they elected, because it's the people that elected them that seem the most angry with them right now. But
so why did they do it? Yeah,
I know it's maddening. But let's end with one final question. This is a good one from a tweeter who sent this. Hi, Peter. He says, why did all of Whitty and Valance's charts and graphs begin in the middle of summer and not at the beginning of the pandemic in March? Interesting question.
Well, this is the trick of all graphs and charts, isn't it? They can be drawn to suggest anything. And if you leave out the fact that deaths have hugely declined and have declined almost continuously since April the 8th, and that the nature of the infections being listed now is wholly different from those in April, and then you get a totally different picture, just as if, as I say, you read my column in Sunday's Mail on Sunday and see what doubling every 7 to 8 days actually means. I had a shouting match, I have to tell you, with an official at the DHSC over those figures, because I was so furious at what I regard as their unscrupulousness.
Yes, it really is quite an extraordinary time to be alive.